Hello, I'm Deandra Simmons.
And I'm Dee Simmons.
And you're watching Ultimate Living. Well, Mom, today we are going to talk to Dallas facial plastic surgeon Dr. Sandy Sule. I think I said that right. He can correct me in a minute. And he has a really interesting practice because he's double board certified by the American Board of Facial, Plastic, and Reconstructive Surgery and the American Board of Otolaryngology or Otolaryngology. I always get tricked up on that word. But he specializes in plastic surgery of the face, nose, eyes, neck, and scalp. And yes, I did have to read some of that. That's a lot to digest in one little sitting. So, but he's here today to talk about his practice. So welcome, Dr. Sule.
Thank you for having me.
Now, did I say that right? Sule?
You got it right in the first place.
Sule, I love that. I bet very few people do get that right. Is that
You're right, about half do and half don't. But you're right.
And you know, you were talking before the show about you being from India, and one of our very dear friends, Dr. Rojni Rao, who's an oncologist at UT Southwestern from India, and how much I love Indian food and all those.
And you love that. You love that. Remember,
I love the culture. I love. Oh yeah.
Yeah, it's very interesting. I was born in the United States, so but luckily we still had some family back in India. My parents had some family back in India, so we've. As children, we're able to go back every couple of years and see and be exposed to the culture.
I always say to Rojni that she's born in India, but she's actually born in Missouri. But I think about that because she always goes back to visit her family, and so that I love that connection. And you're also living in Reston, Louisiana, which I have family from, and I didn't think anybody had heard of that place.
That's right. It's such a small little town, but no, my parents still live there too.
Oh, they do still live there.
Yeah, we try to go back every once in a while since it's relatively close to here, but. Yeah, I have fond memories of Reston.
Well, tell us, I want to know a little bit about your background, where you started, where you went to medical school. Everybody wants to know all those kind of things.
Absolutely. So I was born in Louisiana and I went to undergraduate at Tulane University in New Orleans. And to be honest, I don't think I thought of myself as going into medicine at all. I actually majored in chemical engineering as an undergrad and actually worked for Union Carbide for a little while before I realized that that's not what I wanted to do with my life. And I happened to start working at a hospital and be exposed to physicians and said, well, this is what I wanted to do with my life. I went to medical school at University of Alabama, and then I did my residency up in Michigan, and then did my fellowship in plastic surgery back at the University of Alabama, and decided to go into plastic surgery because it's the one field that allows you to combine kind of a scientific and an artistic aspect. Very few fields in medicine that allow you to do that. Medicine's very heavy in science, but there's very few fields that allows you to combine an artistic appreciation or an artistic like in medicine. So I gravitated towards plastic surgery and I love it.
So you were in school for many years.
Long time.
Longer than I'd want to be, but yeah, it was a long journey, but well worth it.
Very worth it.
It's interesting that you said about the artistic part of it, because there's so many people and what you do in plastic surgery that if they're also artists, so there might be potters, or they might be ceramicists, or they might paint and sculpt, and then they also become plastic surgeons. And I find that their work is so beautiful because they appreciate the aesthetic part of that and the beauty of it, of women and men.
That's right. I mean, I think I've been told this thousands of times from other physicians as well. You can almost train any monkey to do something. You can train anyone to do something, but it takes a certain eye or certain view to do something well.
Right.
And that's really where I think in order to do a great surgery or a great anything, you just need a certain artistic view behind it.
Yeah, I totally agree with that. So let's talk a little bit about your practice. So Dr. Sule, tell us, just explain your practice to us so we know about it.
I'm in Medical City of Dallas, the North Dallas area of Dallas. I've been there now for 5 years, and we do exclusively head and neck cosmetic surgery of the scalp, eyes, ears, anything above the neck.
Okay.
We kind of do that basically because I have the philosophy of I'd rather be a master of one trade than a jack of all trades.
Right, exactly.
So I really wanted, so I've decided to focus my practice on simple things that everyone can see, and probably makes the biggest difference in most people's lives. Most people, obviously, the way we communicate with each other is through looking at someone in the eyes, someone in the face. And so having that ability to help patients with something that's very basic but fundamentally important to them has been very gratifying.
But I also think that you being a plastic surgeon, that you have specialized, like you said, from the neck up. I mean, and that's really talent.
You're going to
say, a lot to him and artistic, because, and I mean, nothing against it, but so many plastic surgeons do everything. Now, let me tell you, you cannot tell me you can be good at everything. I mean, you might be able to fix my face, but you can't maybe fix my thigh. I'm just trying to say, I really respect that about you, Dr. Sule, because you understand that.
Well, I appreciate that. And I 100% agree with you that it is nearly impossible for any one physician to be a master of everything. It's just not possible. That's why we have so many specialties in medicine, from cardiology to any sort of field of medicine, and frankly, we have that in plastic surgery as well.
And many times, because I do a lot of volunteer work at the hospital, and people ask my opinion. In fact, I spend half my life on
answering emails
answering emails. I get up in the morning at 5:30. I have so many emails from physicians, and people ask me, who do I go to for this? Who do I go to for that? And I said, well, like somebody said the other day about their nose. I said, well, just because this person does a good nose doesn't mean they do this good. I think that you've got to specialize. And I have made it a practice at 71 years old to find out the best in everything, And so I'm really glad that you're on today, because this brings a whole new light to plastic
usually,
surgery.
most people that are good in body are not great in face.
That's right.
I mean, that's my experience has been, and I've seen the work all over town. Dallas is a great place to be an observant.
Particularly Highland Park. Particularly Highland Park. Right?
Yeah.
And you have to understand, because the Simmons Cancer Center, I'm there all the time with breast cancer patients. And a doctor that does a real good reconstruction with the flap surgery or whatever they're doing on a breast, he's like, I don't want him working on my face.
Well, you're exactly right. You're exactly right. It just takes a different skill set, a different view, a different knowledge. The human body is so complex. It's almost, you just need that specialized knowledge in something.
So we know a little about your practice. Is there anything that distinguishes your practice from other practices in the field or other doctors that are like you?
Yeah, and I think the biggest thing that differentiates my practice, in my view, versus other doctors is really that, what I was saying before, more that artistic view of people. A lot of things, like you said in Dallas, a lot of people have kind of an older school or older technique way of doing things, which sometimes doesn't give the most natural appearance to someone. And I think nowadays there's been a big change from how people want to look. They want to look more rested, youthful, rejuvenated, and frankly, they're doing things at a younger age to maintain a certain look. So if you don't have that artistic view of what is the best option for people, because frankly, sometimes surgery is a great option, sometimes surgery is not a great option for people, but you have to keep the patient's best interest in mind and kind of their overall views and goals paramount.
And every patient's different.
That's
the
exactly
cases.
right.
So, Mrs. Jones may come to see me, Ms. Smith can come to see you, thinking they need the same thing, but you as a professional, Dr. Sule, you can look at them and say, no, this is what you need. Because you were talking about, I want you to explain some of the very latest, maybe techniques and things that you do.
Some of the more recent things that we do are, frankly, they're non-surgical. And nowadays, people need or want results, but without the downtime, the pain, the anesthesia, some of the bad things of plastic surgery. So nowadays we're doing things like a liquid facelift.
Like a what?
A liquid facelift.
What is that?
Yeah.
It's the idea of creating a look of a facelift without any scalpel, anesthesia, cuts at all. Where basically we use something called cannulas, which are these blunt tubes that we put under the skin to fill in certain areas to create the appearance of a facelift without actually creating any cuts or anesthesia at all.
So what are you filling with that cannula?
Well, it depends on the area of the face, and that's where that artistic view comes again. Sometimes we use different fillers, such as Radius, Juvederm, Restylane, Sculptra, in different areas of the face. We can help people with hollowness or baggy eyes, kind of that tired appearance, kind of smooth that out to give someone a nice smooth appearance. We can do things in the jawline, the jowls, the temple areas, to basically lift, but yet create a natural look.